Good afternoon, everyone. Thanks for joining us. Wanted to give you a bit of an update as we go into this weekend, and I hope that you enjoy the weekend. A lot of community events going on throughout Dutchess, a lot of community days. I think I have 12 scheduled between now and the end of the day on Sunday, and hopefully we'll have a great almost first fall weekend. Currently, Dutchess County is tracking 767 active cases. We talked last week. We are seeing a general plateau of the total number of active cases, and that continues. So the average active cases for the month of September so far have been 754. So really over the last 2 weeks, active cases have remained slightly above 700 and slightly below 800. So we've been plateaued in this 700 plus to 800 minus range. We did, I think, exceed 800 last week for a moment, or 2 weeks ago for a moment. But we are plateaued in the 700 plus active cases. That's out of 300,000 Dutchess County residents, 294,000 Dutchess County residents. Over the last month, August 15th to September the 11th, the largest amount of new cases occurring throughout the county continue to be in the 20 to 29 years of age bracket. So 19% of new cases are between the 20 and 29 years of age. Following that, 15% of new cases occur and have been occurring on average between 30 and 39 years of age, and that's August 15 to September 11th. Of those interviewed, and again, remember, we don't know vaccine status for those who are who test positive. If when we call, and we hope you do, after a positive test comes through, we hope that you respond to the contact tracers from the health department, a series of very basic questions. It's not terribly prodding, but if you answer those questions, and we hope that you do, we can get some information. Of those interviewed and self-reporting, 81% of new cases were among those who either are partially or not vaccinated at all, and this has remained pretty stable. I think we were about 76 to 79%. We're at about 80% on average. For those who are reporting those positive cases, we have identified are either among those, 81% among those who either are partially or not vaccinated at all. And again, we hope that you choose to be vaccinated. I know that there are certainly many who still have yet to be vaccinated. It is your choice. We hope that you get answers to the questions that you have. Seek some assistance from any medical professional that you trust, and I hope that you choose, as I did, I hope that you choose to be vaccinated. We are averaging 1,790 tests daily over the last 7 days, and testing volume is coming up just a little bit. We expected that, as there are employers and others that are mandating either vaccination or testing. And again, these are not Dutchess County instructions. These are either an employer who's made that determination or some other level of government who's dictated it. In those cases, obviously, there are now groups of people who are getting tested more regularly, and we are averaging 1,790 tests per day. We're averaging 88 new cases per day, and that is an average over the last 7 days. Our 7-day rolling positivity is 4.52%. Now, that's down a little bit from the last time I think we spoke, and certainly you'll see we've been really in this 4 plus to 5 below, if you will, positivity rate. And again, it is a positivity rate. It's not transmission rate. It doesn't reflect either individual immunity or individuals who may have gotten and already in quotes recovered from COVID. This is simply the number of positive tests, the number of positive cases divided by the total tests on any given day. Our rolling average positivity rate is now 4.52%. We have experienced 481 fatalities. We certainly we certainly extend our thoughts and prayers to those families that have suffered loss. We know how challenging this is. Now, keep in mind, I do want it to be noted, right? So we don't have all of the data on fatalities. I'll get to some of that in a moment. But of those, of the data we have, we'll try to share what detail we can, and I'll get to that in just 1 minute. 33 hospitalizations. Now, that number has dipped down slightly over the last 8 days. We were at about 40 as we began the month of September. We were approaching 50 hospitalizations. We are at now 33. Now, among the hospitalization demographic, What we've been doing is providing you a 14-day average. So between August 29 and September 11th, our 14-day average is this: 40 patients on average. As I said, we've started to see a bit of a decline in hospitalizations. Again, I think we're not necessarily at a point where we can say we're trending in that direction. We just have seen a plateauing of both total positive cases, active cases, and hospitalizations. Of the average, so 40 patients on average hospitalized over the last 14 days, 72% are either partially or not vaccinated, and 28% identified, and we obviously can prove vaccination in those cases. Of those 40 patients that average, we are seeing, on average, those who are 0 to 18 represent 1%. 1% who are birthed to 18 years of age. 9% fall within the 19 to 44 years of age category. 36% fall within the ages of 45 and 64 years of age, and 54%, the majority, are occurring among those who are senior citizens, 65 years of age or greater. Now, we have exceeded now 75% vaccination among adults. We thank you for that. And again, I hope you choose. It is your choice. I hope you choose to be vaccinated. I did, and perhaps you'll get questions and the answers to the questions that you have, and you'll make that choice. But we are at 75.5% of all adults in Dutchess County have received at least their first dose, and we exceeded that 75% threshold on the 10th of September. We are seeing steady increases in vaccination. Thank you for that. And we continue to encourage folks to make that choice. Again, it is your choice. Vaccination rates are as follow. I think it's important that we understand where we are. For those who fall within the ages of 12 and 15 years of age, we have a 53.1% vaccination rate. 61.3% of those 16 to 25 years of age are vaccinated. 63.6% of those 26 to 34 years of age are vaccinated. 71.8% of those 35 to 44. 67.7% of those who are 45 to 54 years of age are vaccinated, and then the numbers jump up significantly. 84.4% of those 55 to 64 years of age, 97% of those who are 65 years of age to 74 years of age, and those who are 75 years of age or older are at 88.5% vaccination. Now, we continue to support vaccination clinics, and there are opportunities throughout Dutchess. Mondays through Friday from 9 a.m. to 5 p.m., we are at the Family Partnership Center at North Hamilton Street in Poughkeepsie. We will be this weekend at the Village of Red Hook for Hardscrabble Day on September 18th from 11 to 1 p.m. We're at Hyde Park Community Day with Sun River Healthcare. That's Saturday, September 18th from 2:30 to 4:30 p.m. And then beginning this coming Thursday, September 23rd, we're reopening our JCPenney's location in the Poughkeepsie Galleria to offer first, second, and booster doses for those who qualify. All three vaccines will be available at these locations, at the JCPenney's location beginning Thursday the 23rd. Vaccines will be available Thursday from 4 to 7 p.m., again beginning September 23rd, and then every other Saturday beginning on October 2nd from 9 a.m. to 12 p.m. All of this will be provided online and is available for you, so if you have any questions, you'll be able to find it there. So the goal of this clinic is to supplement the community appointments that are available throughout Dutchess County, and there are plenty of opportunities to be vaccinated at your local physician or other federally funded healthcare facilities or healthcare practices. This is to supplement that, to provide some availability that perhaps is easier. These are all walk-in as well, so we encourage you please to bring your vaccine card if you're coming, because if you're getting your second or third dose, they'll just want to authenticate that on your card. So boosters are now only approved, as you likely know, by the FDA for moderately and severely immune-compromised individuals 12 years of age and older who have received either the Pfizer or the Moderna vaccines and completed their vaccination series at least 28 days ago, and that's available. Those are booster shots available, again, at these clinics and others. We do encourage those who may be moderately or severely immunocompromised to consult with their doctors about getting that third dose. We can't provide you that medical advice. We don't necessarily, you certainly don't want me providing you that medical advice. So if you can, before you come in, please consult with a physician. And again, this has to do with vaccinations all across the board. You should talk to your physician, come to the conclusion that you think is best for you. And if you are immunocompromised seeking your booster shot, please do that before you do, just for your own safety, and to be certain that it is the right choice for you and whatever condition you might be living with. For more information about those vaccine locations, you can visit duchessny.gov/COVID vaccine. That's duchessny.gov/COVID vaccine. Now back to school, testing is underway. There is a state requirement for faculty, staff, and administration at school districts to either to be engaged in weekly testing. This is a state instruction, the Department of Education and the State of New York Commissioner of Health. As I mentioned last week, Dutchess County's organized 5 regional testing and vaccination sites to assist. And I'm going to say this because we do pay attention to what people do say online. I want to encourage you to be sensitive to sharing information. I know that we all have a perspective. We all have certainly our opinions, and we're all free to express them. Just be sensitive to the fact that many people are either required to do this by their employers or it's been ordered by some state agency, not county government. But we're here to try to provide assistance. So yes, we want to be sure that we provide assistance. And at our clinics, for those who've asked, we do assist with diabetes. We do assist with other transmitted diseases. This is an opportunity for us to simply assist those employees, staff, faculty all across Dutchess County who are either required or expected to engage in this testing requirement. We're trying to provide some assistance. Thankfully, we were able to secure some grant assistance to be able to do this, and we're partnering with a private sector provider who also is leaning on your private insurance companies and insurance coverage. But we're simply trying to provide the assistance so that it is available and convenient for those who are preschool to 12th grade school staff, faculty, administration, and our locations are available for that surveillance testing as part of your employment requirement. We're trying to be of assistance. So additionally, in partnership with Prophase Labs, we've opened the former vaccine centers, our former vaccination centers for no-cost testing. And again, what no cost means is either subsidized by a taxpayer-funded grant, acknowledge that taxpayers are supporting that, or Prophase is billing, excuse me, the insurance company, and your insurance company is covering that cost. There's no out-of-pocket expense in either case, but that's the mechanism used to cover these expenses, this particular testing. So the JCPenney's location in Poughkeepsie is open Tuesdays from 3 to 7 p.m. The CVS location in Dover is open Thursdays, 3 to 7 p.m., and JCPenney's again on Saturdays from 9 to 12 p.m. This is the lower nasal PCR test. It's not that more intrusive, but it is that they still have to test through the nasal swab. It's a shorter swab. I want to address one last item that you are certainly well aware of. I think you might be. As you know, this week, Governor Kathy Hochul took actions through the New York State Office of Children and Family Services, the Office of Temporary Disability Administration, the Office of People with Developmental Disabilities, the offices that support those with mental health and drug addiction, OASAS and OMH. Requiring universal masking for individuals over 2 years of age in childcare and other congregate settings regulated by these agencies. So what the governor has done is instructed those agencies to issue new regulations as part of their licensing to require masking for those who are 2 years of age or older. This includes all of those licensed child care and daycare providers under the state of New York, not county licenses, but state licenses. This includes OPWDD residences, those with developmental and intellectual disabilities, and those engaged in other services supported by Office of Mental Health and OASAS for drug addiction and support. Yesterday, I sent a letter to Governor Hochul. I did make the effort to communicate my concerns, but I do want you to know that I and Dutchess County government opposes this measure. Now, this is not some outlandish opposition. We've expressed already our concern that parents with their own children should be making these choices in school settings. Also, in a daycare setting, there are a number of issues that play out, including our concern for those with intellectual and developmental disabilities. The instruction does not adequately address the tolerance level of individuals of this age, nor does it take into consideration the World Health Organization's argument, and has been consistent on this from day one, that individuals basically under 4 years of age, those with certain disabilities, just for their own benefit, safety, development, social and emotional development, and their own health, should not be masked. Now, if you remember early on in the pandemic, when we didn't have a vaccine to point to, there were counties that actually wanted to close daycare facilities. The state actually mandated daycare facilities to remain open. And we took into consideration, now Dutchess County wanted daycares to be open as well. We took into consideration the concern regarding the rate of the rate of transmission. And we worked diligently with daycare providers to come up with mitigation steps that would slow the transmission of the virus. We were successful in those settings. Now, no matter what argument one can make, in the height of this pandemic, when we had no tool like a vaccine, nor childcare daycare was mandated to be open, we took mitigation steps, cohorting groups to keep kids sort of isolated from one another, temperature and health checks and screenings as folks entered the building or before they began their day, and other mitigation steps, hygiene, personal hygiene checking, cleanliness and care of the facility. And at the same time, of course, we were very, very diligent in identifying potential positive cases. And we talked about this for month after month. And we said it very clearly, and what the World Health Organization acknowledges is what we have seen across this country. We were not seeing, and still do not see, rates of infection in child care settings that would necessitate, nor would we suggest that masking 2-year-olds is an appropriate next step. It just isn't. And so I've expressed this to Governor Hochul. I did so on behalf of families that are really distraught and concerned about. I've done it really on behalf of the kids who, frankly, in most cases, it's going to be a very, very challenging effort. And of course, the daycare providers themselves. They've already spoken to us about individuals being removed from their businesses. And some might say, well, they made that choice, take them out. And that's certainly an option. But remember, daycare providers and child care providers, they not only provide us a real important service, they're employers. They're businesses, and they need to be able to pay their bills and to remain open. We believe, as the World Health Organization has argued, that this decision ought to be on a case-by-case basis. There are some children. I have a 2-year-old, and I'd pay any politician to spend the day with my 2-year-old and attempt to keep him masked for the day. But that said, I'm not looking for them to be daycare. I have a daycare provider that my wife sent our kids to, a universal pre-K program in the Red Hook School District, where the state says masking is necessary for those who are 4 years of age and older. And a daycare provider locally that is, just distraught. And in those situations, we believe that the daycare provider, the parent, and the child have to come to a conclusion on a case-by-case basis that makes sense for them. And that's what we've expressed to Governor Hochul. So Dutchess County does not support this measure. We are not enforcing this measure. Now you might ask, what does that mean? County government doesn't enforce the regulation over state certified daycare providers. So if you receive or are an OCFS regulated or licensed organization, Dutchess County could enforce the rule, but we choose not to, and we have every right to choose not to. Now, there are daycare providers that fall under county government oversight. There is no rule, which is the other concern. There is not a health department order. It is a licensure order, and that means those who are not OCFS or OPWDD or OASIS licensed don't fall under that particular order, and we are certainly not going to add to it. Now, what are those kind of daycare providers? County governments oversee daycare providers that basically are short-term daycare throughout a particular day, a couple hours, several hours, smaller numbers of young people. Here's the thing. We believe that there are appropriate mitigation steps that can be taken to preserve the quality of daycare, protect the health, well-being, social, and emotional development of young people, and slow the transmission of the virus. Why do we believe this? Because we have the data to prove it. And the World Health Organization and countries across the globe have been able to implement this. We don't think it's appropriate to use the need and desire to have more people become vaccinated, to use the child in a daycare setting and the businesses that are fragile enough in this manner, and we've expressed that to the governor. If you have concerns regarding it, or if you support the measure, you should reach out to your state legislator and to the governor's office. We encourage you to do that. At the same time, however, I'm going to continue to make decisions based on the information that's provided to us. I'm going to lean on our public health officials, and in this case, the Department of Behavioral and Community Health is trying desperately to provide quality information to daycare providers, and we held a meeting and conversation with them today, which is really the last I'll offer to you. I know that we'd all like every level of government to say the thing we want them to say. County government's responsible for 1,700. This county government's responsible for 1,700 employees, thousands upon thousands of residents, and we're trying our best to provide quality information, consistent, concise, quality information to help people make decisions. But ultimately, we want you to make the decisions that work and are best for you. In this particular case, we're going to continue to advise and to assist daycares and child care providers because we think that we're right, that our understanding of both the virus, the science, and the data it does not lead to the conclusion that the governor has established, which is again how I'll end. I've been asked recently many times about decisions other layers of government have been making, and why don't we do what they do, and why haven't we done what they've done. I'd argue that they haven't done some of the things we've done, so we all come to different conclusions. When we're faced with a problem, I'd like to know what the problem is. I'd like to know what solution or tool you suggest will solve that problem, and then determine whether or not it will work. If we have a problem with transmission in daycares, there are tools and steps we can use. This is not a tool that is necessary for this problem in that setting. And that's why it's very clear to us that we encourage parents to work with daycare providers to be patient. We encourage daycare providers to work with their parents and be patient. And at the same time, we ask the state of New York to reconsider this particular order. And I know I've said this 3 times now, but the other concern, of course, in those settings like Office of People with Developmental Disabilities, those with intellectual and developmental disabilities, there's a clear understanding that those living with intellectual and developmental disabilities have to be provided accommodation. And so this particular order currently directs those who even live in their own residences supported by OPWD are masked basically at all times. There are concerns regarding safety, there are concerns regarding development, and there are concerns regarding health. And while I'll give the governor a great degree of credit, she is working much better with county governments than her predecessor. In this particular case, we need state government to be more compassionate and considerate of the challenges facing those with developmental disabilities. And they have lived these last 22 months as second-class citizens. There is no way to describe it any other way than that. The federal government failed them, the state government failed them, and those of us at the local level are trying desperately not to allow them to fall through the cracks or to be burdened with challenges that just are beyond anything that's reasonable. So we ask folks to be considerate of that. We're going to continue to press on this matter, and in the meantime, we just ask that you be safe, stay healthy, and be kind to each other.